Hello, my name is Stephen Rodriguez. I'm a family practice doctor in Dallas, and I've been treating my trigeminal neuralgia for almost a decade now. My assumption early on was it would be easy to treat because if you apply the proper amount of force, effort, tools, Mother Nature does the rest. But sometimes the tissues, particularly in the face, the muscles seem to be unique in that they have smaller fibers, fast twitch fibers, and the fascia myofascial in the face is different. It's like a web, and or a jacket or a bodysuit. It's just a mask. So the acupuncture needles have a very they're flexible, and they have a kind of a nose cone ice pick sewing needle tip, and they're flexible. Yesterday I was playing around, and I felt a teeny weeny little shock, different than the pressure or ache or kind of like a little speckling of pain. And I'm thinking, well, Steve, jump on it. So I'm using my hypodermic needles as acupuncture needles because these needles have a cutting tip, and they cut the fascia, they cut the myofascial, they cut the muscles, so that I'm going to try to stretch them out and give the fascial and the muscles more room to heal properly. So at this point, I call this muscle cancer. Stage 5, pain, muscle cancer. The muscle tissues have just distorted beyond their ability to function properly without sending out distress signals. Unbeknownst to me, this would happen to me, but that's okay. I have the treatment in my hands. If I didn't, I don't know what I would have done. They call this the suicide syndrome, and I know why. On any account, I can feel the old kind of, it's just a slight little that. So the muscles will build up the electricity, and then it'll release it. And it'll release it like that, or like a taser, and it will wake you up. It will feel just like a taser, just like one of those little batons, shockers. Identical. Well, close enough. But on any account, this little spot keeps. I'm going to do an experiment. I'm just going to wear needles there for a whole day, maybe 2 or 3 days. And that I'm able to sleep in them, because what I do, I put them in and I fold them up and I kind of tape them down. So they're there. They don't bother me. I know they're there, but I want them to stay there and see what happens. It worked in the past, and then it didn't work. But I'm going to do these 2 steps. Okay, so you can see there's a little blood in there. And there it is. It just, what it does is I can feel it, and it gives me an itch across here. And I can feel it's just like putting your finger on a burn. It's like, ouch, ouch. You push it, ouch, ouch. And that's a clue that that's where it is. And call myself doing perpendicular and a corner of a square, basically. So I'm getting it at these angles. Now that, when I put it in initially, it gave me a pretty good ouch. And now it doesn't, so I'm gonna move it. There it is. So I just kind of moved it this way. Oops, no, it's not, it's bending. So the hypodermic needle is flexible also. It's less flexible. I don't have one here close by, but it'll bend. You put it's like putting a sewing needle trying to push it through leather. It won't go. You really have to force it, and it has to be sharp enough, thick enough to go through. If it can't go through, it can't disrupt the corrupted cancer-like tissue, because it has the same definitions as a cancer cell or cancer tissue. And you treat it just like cancer. You jump on it and you don't stop until you're done. And again, I'm talking. It doesn't hurt. I can feel they're there, but I'm going to go drink some coffee, do some writing, and I might give you the second, third, fourth part of this, but you get the idea. You just dive in and you kill it, just like it's an alien. So it's an alien in there, and the muscles they transform from nice filet mignon to this dry, corrupted ball of misery. And it turns from, there's this phylogeny. Our evolutionary design comes from prior creatures, fish and eel. Eels' battery setup are muscles, and they'll charge up and then they'll discharge. The eel doesn't bother the eel, don't know why, but in us you feel it, and it is miserable, and it'll shock anywhere on your body, from your finger, anywhere there's a muscle. So this is the treatment for pain, not cancer, not infection, not corrupted bowel, for pain. This is a scar. This is you. You can't separate it out. I saw a picture of a group of doctors removing one of these out of someone's glute muscle, their butt muscle, thinking that they could just remove it. No, you can't. It's like a weed or a spider's web. You can't remove it like that. That is utterly bizarre. You can do it. You'll leave a big scar. The patient will still be miserable because the dendrites, or the web goes up and down the spine. And once it goes up and down the spine, it can branch out anywhere around your body. That's what it does. That's my explanation for how miraculous the human body functions. We can't figure it out. All we have to do is do. That's it. Once you got the diagnosis, doc, I got a problem, you jump in. And I'll post some more information about my thoughts. Rethinking. Have a good day.